in the upper back, right? I'll do a little bit of soft tissue work down the calf, right? There are some trigger points that are going to be within the calf that you're going to kind of feel. I'll do some active release technique there as well, okay? Again, I'm going to concentrate on exam on the upper back just to kind of figure out where your area is at. That referred pain down the arm can come from multiple different areas, okay? It could come from a supraspinatus muscle. Okay, it's going to be right above the scapular border, or the scapula, and sometimes refers down the border. That's why I was asking if you had it around the scapular border as well. It could come from a rotator cuff muscle. Okay, it could come from an overworked deltoid muscle.
Yeah, it's basically when I lift like this, and I feel it all right up in here.
All the way in there. Okay. All right. So let me get in and do some little bit of pinpoint exams, so that I can try to get a better idea of where it's coming from. Okay. So actually, let me have you turn facing that way. Okay. And I'm gonna just start right up here and just do a little bit of palpation. Okay. So I'm gonna palpate right in here. Are you feeling any associated tenderness with this guy?
A little bit.
A little bit. Okay. Over here.
Yep.
Yep. Over here.
A little bit there.
Here?
Yep.
Here?
Not as much.
Nope. Here?
No.
Nope. Bring your shoulders back for me. Right there. Okay, good. Here at all? No? Here, yes?
A little bit.
Yeah. Here?
Yeah.
Okay. All right, I think we're almost gonna pinpoint it here really quickly. Right in here?
A little bit.
A little bit. Right in here?
Yeah.
So that, you see the biceps tendon here? Okay. Right in there. And then, so when you lift like this is when you have most of your issue there, right?
Yeah.
Okay. So that guy right there will definitely have you it's like an achy, dull, like that achy toothache kind of pain here. It just doesn't go away. You lift, it gets worse, on and so forth. Okay. So we're going to work that trigger point here. Okay. Let's come here. Put your arms out to the side for me. And don't let me push down. No pain with that? No. Okay, good. Put your hand like this. Okay, and then you're gonna do like if you're doing a bicep curl.
Okay.
Go ahead and go. Pain with that?
No, not as much.
Okay, go. Pain with that?
No, not as much.
But when we get deep in here, you got that pinpoint tenderness, right?
It's usually when I'm doing this.
Yep.
No.
But you won't feel it there.
No.
It's the thing is, it's gonna be more related to fatigue. So is it after like several repetitions of doing that?
It could be actually at any point in time during the day. Actually, because I'm doing a lot of lifting, I'm lifting a lot of heavy stuff at work.
Okay.
So, when I'm pulling a lot of work like this, eventually after a long period of day, maybe something like this right here. But that's been a consistent pain over here for months.
Okay.
So.
All right. So I'm going to get in here and work on some of these trigger points in here. Okay. I'm going to do a little bit more testing just to rule out. I've already ruled out a couple of rotator cuff muscles. I'm going to try a couple more. So have your arm like this for me, right there, and then we're going to do external rotation. Okay. So push out. Any pain with that? No. Okay. We're going to go internal rotation. Go in. Any pain with that? No? Okay, cool. So I'm doing a couple of tests just to rule out rotator cuff muscles, okay? None of the rotator cuff muscle fatigues that are associated with injury, sprain, tear, so on and so forth are coming out positive, right? When you're explaining this to me, it sounds more like a biceps tendon. So that was what was going through my head as we were chatting a bit, okay? And then I've confirmed it upon palpation. So what you do is you find the bicep muscle, you kind of work yourself up, and then you find that trigger point within it. It's like a little knot, and it's like, oh wow, that's tender. So that's the one we work on. We strip it and get some soft tissue work on it, okay? We were also talking about a possibility of something down the leg as well. So I'm gonna do some exam here on the leg, okay? So you said, talk to me more about the surgery. You said you had, what were the symptoms at the beginning when you first started? Why was the reason you went for surgery?
I had problems walking, but I think the cause was because I was in martial arts and I was doing a lot of kicking. Okay. And I think I was kicking the bag wrong. Right. Where I ended up doing a lot of tear on my ankle.
Was it the top of the foot, the bottom of the foot, the side of the foot?
When I was kicking?
Where was it that you had the pain?
Oh, all up in here.
Okay, cool. So where you were kind of kicking and that force into the bridge of the foot?
Yep. And that's doing a lot of jumping too, which ended up cracking or creating a bone spurt.
Okay, cool.
Which was the fracture, the little tip of I don't know what it's called, the tip of bone here. So a little chip came off, so it was floating inside.
That was kind of breaking up all that scar.
Oh yeah, man, it was major.
Right. And then you got a foot insert, and you said it took away all that pain.
Well, this was 4 years after I decided to say, okay, I've just spent thousands of dollars and trying to figure out what therapy I went over CAP for, and then I went to cortisone, which helped me for about 3 years to just have me be able to walk and do my job because I wasn't recovering properly from the surgery. So eventually I ended up going to try to get blood plates re-injected. So they take the blood out and then spin it and then re-inject it. So I did that twice. It kind of helped. A lot of athletes do it too. So, but it's still expensive to have it done out of your pocket. So they didn't tell you, oh, it's not just going to work once. Oh, it may not work a second time, but you may have to do it 2 or 3 more times. But when they tell you you need to do it,
you just do it
only twice.
Right.
So it's kind of a load of BS system to try to bring money into their pockets.
Okay.
I understand about business, but when they can't be honest and upfront with you, tell you ahead of time. So I finally made a decision to go ahead and get inserts. So I tried a bunch of inserts, and then finally came up with Dr. Schultz inserts.
Okay, and then those kind of relieved some of the issue.
It really did. I mean, it was like night and day recovery kind of thing.
Did anybody ever do an exam on your feet before?
Well, I went to a specialist. I was going to a specialist for 3 years. He was always doing x-rays and injections on me.
Okay, let's do something right now. Let's have you take off your socks for me. And then turn this way because we got a little bit more space over here. Okay, and I want you to just kind of start right here. Right where you're at. Okay, so you're going to start from a seated position.
Sorry.
No, you're good. Start from a seated position.
Okay.
Okay, and then I want you to stand up. Okay, come back down to a seated position. Stand up. Okay. Okay. Do you notice how your foot wants to roll in on both sides?
Yeah.
The arch kind of flattens out.
Yeah.
And so now sit back down. Stand up. See how that takes some of that pressure off of that lateral side there? Okay, so that's why you got that support when they did those, when they put those inserts, possibly that helped your foot.
I figured
when you, exactly,
they didn't tell me.
So when you got those inserts, it possibly helped support and take pressure off of that flat foot, causing you to have that strain on the
I mean, when all this right here, when it's going down in that way, you're going to build irritation. So when you put the inserts in, it helps heal whatever irritation and inflammation that's actually occurred. So.
Good. All right. So and we noticed kind of both of them have that same kind of drop.
They do. This foot is fine. I don't have any problems with this ankle or walking. It was just my right foot was always my power foot, my football foot, my kicking foot.
So it was probably a combination of trauma with flat foot and then here we are. Okay. So and then you said now you still kind of have some tightness in the back of it.
Well, I've always had knots in the back. But for some reason my knots started coming back really hard within the past couple weeks. Okay.
So I'm going to do a little bit of an exam here on some of the lower leg muscles here. Okay. Mainly the calf muscle. Okay. Just to kind of feel if we have some irritated trigger points. I'm going to do check one side versus the other.
Okay.
In some of these situations where we have irritation on one side, you'll feel like maybe one bothers you a bit, but the other one is really painful upon palpation. Okay, so we'll have you lay face down here for me, and I'll check out that calf muscle. Okay, very good. All right, so just kind of
edit out my dry feet on the bottom.
All right, let's see here. Is it your right foot or left foot?
Right.
Right.
Okay. There's a lot of knots in there.
Now, remember I told you might feel something there, which you kind of do. You feel that little thing?
A little bit.
A little bit. But over here,
you
have that accelerated, okay? And then you're going to notice the difference of how this one kind of gets overdeveloped right here versus this one.
Yep, that's why it's my power foot.
Okay. Remember, I was telling you that we have a massage therapist who focuses on some leg rejuvenation massage. She focuses on hamstring, these trigger points here, all the way down the Achilles tendon into the foot, plantar fasciitis, these types of deals. Okay. These types of soft tissue treatments is what she concentrates on. She's done a couple today.
Cover this?
It just depends. Usually they don't cover the massage.
Yeah.
But we can look at what you've got and try to take care of you.
Okay. I don't know if my insurance covers it.
Today you're covered by the J-Train insurance.
Oh, thank God for Jay.
Okay, you feel it. Now I want that same motion I'm doing with your foot, I want you to do it now. Like that. Kind of here.
You want me to
Yep.
twist?
Mm-hmm. Go.
Right now?
Yep.
Okay.
Good. So you're gonna kind of go like this, watch. You're gonna go down like that. Down. There you go. 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 Get in. Okay, relax. Do it. Good, relax. Go. Good, relax. And go. Okay, good.
That's really painful.
Sorry.
It's alright.
No screaming, you have a potential of millions of people watching this video.
I know.
Alright, good.
Grit my teeth.
Alright. Okay, very good. Alright. You okay?
Yeah.
Alright. So we're going to perform a chiropractic adjustment, okay?
Okay.
So we'll have you sit up first real quick. How does that leg feel right now? Just right after there's just a little bit of that soft tissue work.
Oh, it feels a little bit better but it's still, I mean, you put a lot of pressure on it, so I'm gonna feel sore for
So
the day.
it'll be tender for a few days.
Yeah.
It's that knot started very, very pronounced.
Yeah.
And it started to kind of melt away as I was working it. Okay. If I work it too much more right now, with the amount of pressure I bring,
Might damage the tissue.
well, it's just you're gonna be very sore, and we may not get more progression. So what I would probably do today is lay off of it, right?
Okay.
And then do a follow-up. Now, when you're getting in here for like a full leg rejuvenation massage, she would not only work that one knot, but she'd work soft tissues around it to try to help loosen up that compensation of that calf muscle. Okay.
Okay.
What we're gonna do today as we demonstrate, as we told you on video, we demonstrated a little bit of active release technique on the calf. We're gonna do chiropractic adjustments. Okay. We're gonna kind of show video on what an adjustment is. Have you ever been adjusted before?
Mm-hmm.
Okay. So I'm going to find some areas of restriction. Okay. Our vertebra should have 6 ranges of motion: lateral flexion to both sides, lateral rotation of both sides, then forward flexion and extension. Okay.
Okay.
So we're going to demonstrate those. Then I'm going to work a little bit on some of your soft tissue muscles in the upper back, and then we're going to turn your face up. I'll adjust your low back, the entire body, turn your face up, and I'm going to do some active release technique on that biceps tendon as well, okay?
Okay.
Prepare to feel that kind of heat on your base, on the bicep tendon, okay? But hopefully after the day, you kind of get that release of, and that's what we experience with a lot of our athletes who come in. They'll come in, we do a focal soft tissue treatment like we did right now, okay? And then they'll report a few days later, well, this was able to happen. It was at a 9 out of 10, and now it's at a 4 out of 10. And then a few visits after that, it goes away, and we just kind of keep them on, managing your body, okay?